Dialectical Behavior Therapy for children, also known as DBT-C, is an evidence-based treatment that is an adaptation from the standard model of dialectical behavior therapy in order to more effectively serve the developmental age of children 6 to 13 years old. The goals of DBT-C include treating the child's current symptoms, to treat the child's environment in order to support behavior change, and also as a preventative measure to reduce the child's risk of harmful and destructive psychopathology later in life. DBT-C has been proven effective for treating children who are experiencing emotional dysregulation, impulsivity, physical aggression towards others, destruction of property, verbal aggression, suicidality, self-harming behaviors, interpersonal difficulties, depressive symptoms, anxiety, and low self-esteem. There are 4 main components to how DBT-C works. These include intensive parent training, child's individual therapy, family DBT-C skills training, and phone coaching. To break it down, the first one, intensive parent training, includes parents or caregivers learning evidence-based parenting strategies that they can implement in response to their child's behaviors, and also helps them gain an understanding of how behavior science works and the functions of their child's behaviors. Also, what teaches them how to create a validating home environment. A validating home environment is a crucial foundation for a child's ability to achieve long-term behavior change. The goal of parent training is to provide parents with the necessary tools and real-life practice with these tools during the treatment so that parents can confidently coach their child towards adaptive behaviors after treatment has ended. The second component, the child's individual therapy, begins after the completion of the parent training. So the child is brought into therapy and it develops their own personal life worth living goals. These are the goals that they want to work towards that helps promote feelings of hope, excitement, and joy in their life. Also develops targets with their therapist, which are broken down steps that get them to those goals. They work towards these goals and track these weekly. Additionally, in the individual sessions, the child also learns emotional psychoed that's provided to help them develop a new understanding of their emotions, what their emotions are doing for them, and change their relationship with their emotions. The third component is the family DBT-C skills training. After the completion of parent training, parents or caregivers and the child also devote a portion of their weekly session to learning the DBT-C skills. These skills are adapted from the standard model of DBT to be more developmentally appropriate for children 6 to 13 years old. Families learn and practice the 4 modules of the DBT skills, and these include mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. The final component is phone coaching. Both the parents or caregivers and the child have access to their DBT-C individual therapist between sessions via phone call or text. This serves to assist in generalizing the skills and strategies that the family is learning into their daily lives. Utilizing phone coaching increases the consistency of skill implementation, prevents ineffective responses to the child's maladaptive behaviors or behaviors we don't want to see, increases parents' emotional regulation in stressful situations, and also prevents unnecessary hospitalizations during crises. So what makes DBT-C different from other therapies? In DBT-C, the child does not need to commit to participate in therapy. Only the parents need to make a commitment to the treatment. So this is an ideal therapy for children who are therapy resistant or unable to fully participate in therapy for various reasons. DBT-C can bring about behavior changes in the child, even if only the parent training component is completed. The entire family is seen as a patient, and both the parents and the child have access to between-session phone coaching with their DBT-C therapist. Another addition to DBT-C is that it also incorporates identifying and targeting vulnerabilities that the child and the parents may be experiencing. This might include the internal relationship with themselves. For example, low self-esteem, difficulty trusting others, feeling undeserving of love or belonging, and more. DBT-C is a total package that includes intensive parent training with follow-up parent sessions, learning the 4 modules of DBT-C skills, emotion psychoeducation, access to phone coaching, and individual sessions with the child to work towards tangible goals. If you're ready for positive change in your family, DBT-C knows how to help. Connect with us to speak with one of our DBT-C specialists to learn more.